So continuing in this series, let's see the utility of dry lab, that is part of our set facility. We have already discussed about various aspects of the platform that we have, and these platforms are helping us to integrate various aspects. When we talk about the dry lab, basically the utility of this dry lab is across the specialty, super specialty, and it is being used for College of Nursing as well as for nursing students and other paramedic staffs to use this lab for not only learning new skills but to strengthen and make it more efficient for the skills which they have learned it. And we have been using this dry lab for benefits of various cadres, including undergraduates, postgraduates, super specialist students who are coming even for fellowship, nursing students, allied specialities, and more recently we have added to be used for paramedics, non-medics and lay persons, because these are part of our team, and basic teaching and training definitely help us to give a team approach for management in clinical care. And what exactly we do in our dry lab at the SET facility, we impart skill training and practice. And we have learned earlier when we talk about the blended learning, it has been integrated in the blended learning that some aspect of theoretical aspect is online. And once they are through with the online module, they come for the skill training at a pre-specified time. This set facility of dry lab is also used for assessment of the candidates that we have. Once they have learned, we can make examinations, do assessment for them. We also demonstrate certain things, certain complex situations for them so that they can understand the complexity of a particular situation, and then either using a task trainer or full simulation, we can demonstrate those complex procedures also to them. We have been using dry lab for digital learning because COVID has made us to use it in a hybrid model, and certain skill can be demonstrated even in a distance learning approach for online models. We have been using for refreshing the skills for training of training programs, and the SET lab is progressive towards the development of various skill modules that can be used uniformly across various teaching and training sessions. And in addition, more recently, this SET lab has become a center for various research purposes, and certain theses and dissertations are based on skill simulation. Now, coming to the first important skill that has been imparted through the dry lab is this cardiopulmonary resuscitation. It is across all the cadres because we want to generate the team of resuscitators, including doctors, nurses, paramedics, and more recently we have used laypersons because, as we know, that the cardiac arrest happens outside the hospital most of the time. So we want this, that each hospital worker should be well aware of the CPR skills. And various programs has been started, which is either the accredited courses at the international level, or we have in-house generated the courses as per the need of our in-house staff, including the nursing professionals and other lay persons which are working inside the hospital. The dry lab also have an advanced airway training laboratory, which has not only the task trainers but the complex airway simulations can be done. We have been teaching various aspects of airway management, including supraglottic airway training, difficult airway training, use of video laryngoscope, awake intubations, and using endoscopic methods. And this has been integrated into a simulation-based airway training where various aspects of the airway management has been integrated. And this has led to the process of simulation-based training, which can be integrated with some research purpose also, and various air-related theses are being conducted at our dry lab. Various cadres of the medics and paramedics are involved into conduct of this airway workshop, not only for undergraduates, but we have been conducting airway management for postgraduates as well as for the paramedics. The ultrasound simulation laboratory is well equipped. It has advanced simulation which can simulate various aspects of ultrasound guided vascular access, ultrasound guided cardiovascular imaging, ultrasound guiding regional blocks, and we have been using for various situations, not only for adults but also for pediatric population. And various courses has been done, which is for emergency medical students, for medical oncologists, because they are more concerned with the vascular access. We have been using various situations and simulation for emergency medicine department, and also have been used for various cardiology aspect where we are looking for the various cardiovascular aspects. And various workshops are being done not only for the demonstration purpose, but the hands-on practice is also being given to these participants so that they can learn the nitty-gritties on the mannequin before they actually come on the patient's management. Even the stimulator can simulate those regional blocks because the anatomy can be easily visualized on them, on those task trainers, and they can be supported by actual volunteers also, so that the student gets a real-time knowledge of the regional blocks before they actually do it on the patients. The skill lab, the dry lab, is also used for training of trainers because the expansion of the skill lab across the cadres is happening, and hence we require a lot of capacity building so that each department, each specialty, each cadre can have some trainers to train their in-house departments or the area where they're working up. And this dry lab is helping us to create training of trainers, which happens in the physical mode, wherein we teach them certain skills, and then the practice session happens for these trainers also. During the COVID time, many training of trainers programs has happened online across the specialty, across the state, across the India, and this is being again utility of the dry lab of the SETS facility. As mentioned earlier, the blended learning is one of the emerging modality, and we are using this blended learning model for teaching and training for the undergraduates, postgraduates, and the nursing professionals, wherein certain part, as mentioned earlier by Dr. Avneet, where we have a Saral platform where we upload certain presentations, certain SOPs where they can read it, and when they understand those basic aspects, then they come to Skill Station for learning these aspects. In COVID-19, the Skill Hub was very efficiently used for capacity building, not at the institutional level, but also national capacity. The Skill Lab was very well used for various resuscitation aspects in COVID-19 patients, airway management in COVID-19 patients, because teaching these skills in actual real-time scenario poses an hazard, but using this Skill Lab has helped us to train these special skills without any hazard to the trainers. We have used it for the pediatric patients also, for the pregnancy-related situations, and this has really helped even for the nursing professionals to prepare them for taking care of kids during the COVID-19 pandemic. And this has created a lot of interest across various states and stakeholders, which has been really emphasizes the importance of having this skill lab. The various departments has been using it for various purposes, not only for teaching training. This has become a hub for even for assessment for the final exit exam for these students who has learned it, so that they can be really assessed on simulated aspects. And various courses has been done by various department as per to their need, and this can be easily modulated as per the need of a particular specialty. The gynecology department is doing various aspects relating to the various aspects of obstetrics and gynecology aspects, and they have been successfully using and conducting this dry skill lab for teaching and training of their undergraduates and postgraduates. Even for the anesthesiology, various skills which were a little difficult to treat on a real-time patients, now they can be easily taught in this simulation lab using task trainers, and even can be simulated for a complex case scenario, so that they can understand the nitty-gritty of an overall case management. The pediatrics, the Department of Pediatrics has been using it for various type of programs, including the resuscitation during COVID time, creating the capacity for oxygen stewardship program, and they have been using it for various aspects of improving the quality of the care that can be imparted to the pediatric patients. The nursing department has been using it again for various purposes, as simple as skills of NG tube insertion or for ET suctioning. So there have been modules developed, and then they can come on in this skill lab to learn this practice on the task trainers, which is helping them to get the real-time feel of these specific skills, and then they can go back and use it in a real-time scenario for patients management. The nursing professionals have been conducting various courses at this skill lab for the benefit of their students. We also have specific skill training for our MBBS students, which has been prepared in the form of modules in blended learning, and we have divided them according to their semesters in MBBS training, and this is really helping them to learn the nitty-gritty of various techniques that are considered essential as a part of their MBBS curriculum. Not only the medicos, but we have started imparting training for physiotherapists like respiratory therapy and resuscitation because they are part of teamwork. Even the school students have started coming to these centers for learning these skills because this is helping them as a part of our social commitment to teach the students to learn the basic aspects of CPR. Even now, we have started teaching using the skill lab for teaching CPR to laymen, including the yoga staff, the paramedical staff, including guards and sanitation workers, in addition to our school students. And this course is quite getting popular, creating more enthusiasm, and we are expanding our horizons for using skill lab not only to medics, paramedics, and nursing professionals, but to other staff members also. And this teamwork, we are creating a team which will provide us a better quality care. Having said that, this skill lab is emerging as a research hub. Many research projects are going into skill lab, which is giving us an idea and reiterating our assumption that teaching and training on a skill lab is also a better option for imparting better quality of care to our students. And this is being showcased in various exhibitions, which is very well appreciated across the specialty, across the medical colleges, and this is giving us a good outcome in the form of our standardized skill training modules. This skill lab is helping us to have a centralized, unified training platform, which is improving standards of teaching and training for our students. It will provide better education of medical and nursing students, which will lead to better patient care. And definitely the emerging research will add on to the utility of skill labs for better teaching, training, and improving our standards. Thank you so much.